Medication administration, Sarah Layton. Okay, I'm going to start by scanning my room. Okay. Just according to University of South Alabama College of Nursing, I will begin by comparing the MAR to the patient care order form. I have Jaguar Jones. He is allergic to penicillin, so I'll make sure that none of our care includes penicillin. Today I'll be administering heparin, which matches the heparin on the MAR, 5,000 units, subcutaneously, every 12 hours. Now that I have compared the MAR and the patient care order form, no longer need the patient care order form, so I'm going to set it to the side. I'm now going to move on to preparing the medication, so I'll start by doing proper hand hygiene with an antiseptic rub. I'm going to pick the correct medicine from my vials. So I am going to use heparin. I have heparin here, so I'm using heparin 5,000 units. I am given heparin 10,000 units per milliliter, so in order to do 5,000 units, I will only administer half a milliliter or 0.5 milliliters. Now I'm going to verify. This is heparin, 10,000 units per milliliter. Expiration date 2025, so the medicine has not expired. Now going to pick my syringe. I'm going to use a 1 milliliter TB syringe since I'm only administering half a milliliter. I want to open and maintain sterility. Just going to verify that this is the TB syringe. TB syringe, 1 milliliter. Here is the packaging. Okay. And now I will clean the vial with an alcohol pad. I'm actually going to keep the alcohol pad on there. I'm going to remove the needle cap. And I'm going to draw out 0.5 milliliters of air to help with the bubbles while drawing the medicine. I'm now going to remove the alcohol pad. Going to dart the needle into the vial, put it upside down, stabilize it. Going to push those 0.5 milliliters of air that I drew. When I draw the medicine, I'm going to draw a little bit more than 0.5 milliliters, again, to make sure I have room to make up for the bubbles. So I'm actually going to draw 0.6 milliliters. I'm flicking any air bubbles out that I can, and then go right up to 0.5 and make sure it's precise. I'm going to remove it from the vial. I'm going to scoop the cap and secure it. To maintain sterility, I will not touch the top of the cap. Now I'm just going to verify for the camera that I have 0.5 milliliters of heparin. And once I have completed drawing 0.5 milliliters of heparin, I will then add a label. So I've made a label and I can show that for the camera as well. Heparin, 5,000 units, 0.5 milliliters, and I have Jaguar Jones on there. I'm just going to stick that onto the medication, and I would then take my MAR and my medication to the patient's bedside. I would start by entering. I'm going to perform hand hygiene. Hello, Mr. Jones. I'm Sarah Layton. I'm going to be giving you some heparin today. I'm just going to verify that I have the correct person. I have Mr. Jaguar Jones. Jaguar Jones. Date of birth is 8/25/1963, and I have 8/25/1963. And his medical record number is 417-6352, and that matches my 417-6352. I see you're allergic to penicillin, Mr. Jones. What kind of reaction do you have? Okay, well, I can assure you that I won't be giving you penicillin today. I will be giving you heparin in your abdomen area, and you should just feel a slight prick, but I'll let you know it's gonna happen. Okay, at this point, I would raise the bed completely and lower a bed rail. I'm going to put on clean gloves. I would remove his gown, and I'm going to inject in the abdominal area since it's a subcutaneous. I'm going to have certain regions, so my region is going to be below the costal margin, above the pubic area, and in between the sides of the anterior superior iliac spine. So it's going to make a U, and I'm going to stay away from 2 inches of the umbilicus. So I'm going to take my medication and an alcohol prep pad. Going to put in a prep pad. Going to clean the area of injection with a circular motion. When I'm done cleaning, going to point my swab at the area I cleaned. I'm then going to remove my needle cap. And remove my alcohol swab. I'm going to pinch the skin and at a 90-degree angle, inject. And while keeping it pinched, I'm going to inject the heparin. And then remove the needle and release the skin. I will put the needle and cap both in the sharps container. I would then cover up Mr. Jones and put him in a comfortable position for him. Lower the bed back down and raise the bed rail. I would stay to make sure that he has no allergic reaction to the medicine. I would also ask and make sure that he doesn't have any pain or feel any adverse reactions to that medication. I would then remove my gloves, throw them away, complete hand hygiene. And now I will move on to documentation of the medication administration. So this is the point in which I would document that I did indeed give Mr. Jaguar Jones heparin 5,000 units, which was 0.5 milliliters, subcutaneously after 12 hours of not giving it to him. And I would just document if he had any allergic reactions or adverse reactions to the heparin. And that completes medication administration.